So like trying to like how will I put it, try to round up on limb issues. We'll talk about limb reconstruction because we have spoken about, your limb is not being what, how will I say it, it's not like your two legs are not equal. All right, it could be issues with what, dislocation of the hip and a lot of things we spoke about. Now, what is the solution to this? There's some things called the SUPERknee. It's kind of like trying to reconstruct those areas that are affected. So what are they? Okay, so I'm trying to like reconstruct, give strength to a joint, do all those things. So SUPERhip and SUPERknee, they are just procedures that are part of specialized approach towards limb reconstruction and lengthening. You understand? So a patient happens to have, two of his legs are not the same, length. So I want to rearrange this condition for him. Okay. So, so let me say in conditions like congenital femoral deficiency, fibular hemimelia. Okay. So SUPER stands for what? Systemic utilitarian procedure for extremity reconstruction. It was started by what? Dr. Dro Pale. Okay, so let's talk about a SUPERhip. SUPERhip being this one, so it reconstructs the hip joint in patients that have what, hips that are not stable, or your hip is not developing, properly. You understand? So technique, we have things like realignment of what, the femoral head and the acetabulum, use of specialized implants, soft tissue releases to improve what, mobility. Goal is to create a stable, a joint that is mobile, okay, and a joint that can actually what, support future limb lengthening. You understand? So SUPERknee happens to be this one, although the image is kind of like far. The SUPERknee, you're just trying to address what, knee instability. Now look at the band that it pass around the knee, kind of like tying it to be more stable. You understand? So key step is reconstruction of what, ligaments that maybe have been like slacking. So have the what, anterior collateral ligament, posterior collateral ligament. Then realignment of the kneecap if necessary. Construction of flexion what, contractures via the posterior what, via posterior capsulotomy. Then customization, you just have to tailor it based on the need of, or based on the patient, what the patient actually needs. All right, so these are two ways in which you can actually approach limb reconstruction and lengthening. So they prepare the limb for safe, effective lengthening surgeries. Right, they help to avoid complications that might come up. Right, so it's often used in children that have all those congenital limb issues, because you want to preserve natural joints and improve the functions. All right, so that's it.